sleeping on the hospital floor after a shift. Nurse horror stories from Rio de Janeiro. Hit hard by COVID-19, but poor and struggling. Even in one image that shocked Brazil, the dead lying next to the living. Rio State's medical workers are dying more than anywhere in Brazil. 30 doctors and 40 nurses or workers. Here's nurse Danielle Costa describing her symptoms in isolation days before she died. Her friend Libya, a nurses' union head, has had the virus and is hiding enduring lung problems from her family. She is better though, enough to go back to work. The worst, she says, is when in despair to help someone who's arrived newly in the red zone. We have to stop preparing a dead body for the morgue and leave it to the side. When Danielle died, it was in a hospital 4 hours out of town, and Libya had to fight to get COVID-19 on her death certificate. The last time we spoke, she was radiant, she says. Her dream was to work again in the ambulance service, and her dream was coming true. We queued 4 hours to apply for these jobs. She hugged me, although we could no longer hug at that time. She was happy she would use the uniform again. It was her dream. PPE shortages are complained of, even though in this hospital ICU we're told it's okay. The number of dying in Rio are hard to comprehend, even though some say they're underreported. In this hospital's ICUs, there are 88 full beds, and about 6 to 8 patients die every day. That's about 10% of ICU patients a day. The container's out back with room for 75 bodies at a time. The peak hitting Rio now, some experts think, with healthcare staff already exhausted, mourning and burdened. Nick Payton-Walsh, CNN, Rio de Janeiro, Brazil.